Our next segment is going to include some organizations in this area, in these two counties, that have actually invested in health improvement in the past, different stages for different organizations, but people who've done what we're talking to all of us about doing today, and that is saying inside our organization, we have a lot of people who work for us. What can we do to start to make progress in some of these areas and improve health? And we're talking about some programs that have been focused on exactly the three priorities we talked to you about up here. So we're going to have a panel. It'll be moderated by Dr. King. Each of the panelists is going to talk for just a few minutes about what they've done inside their organization. And then hopefully at the end of that we'll have enough time, because we're a little behind on the agenda, but hopefully we'll have enough time to field a couple of questions for these individuals. And in addition to Dr. King returning, we have Karen Retherford from the Santa Rosa County School District on the panel, and y'all can come on up. Ted Kirchharr with the Landrum Company, representing a smaller business. John Weber from Escambia County, and Deborah Napier from Gulf Power Company are the members of our panel. And I believe that Karen's going to talk to us briefly first about some things that the Santa Rosa School District has done.
Great, thank you, David. So as you heard, this panel is going to be about talking about real-life implementation of some of the strategies you heard from Dr. Vinci. And we've asked our panelists to just take a few minutes, just about 5 minutes or so, to share some of the work that they're currently doing. And hopefully we'll have some time at the end for some Q&A for you guys to start answering some questions of us and of our panelists. So with that, without further ado, I'll just turn it over to Karen to start us off. And Karen, why don't you share with us some of the things that you guys are doing?
Thank you. I appreciate the opportunity, first of all, to be here today and share some of the information regarding the wellness program that we have in the Santa Rosa County School District. Several years ago, our school district developed a wellness policy, and that has really been our foundational piece for all of our wellness initiatives. We basically targeted two groups. First of all, our staff, and then secondly, our students. And may I have the clicker, please?
Oh, sure.
I apologize.
You might need this.
Yeah, I might need that. Thank you. We started with two groups, our staff and our students, and our primary areas of focus have been staff wellness, nutrition education, and physical activity. Knowing that we could not really drive wellness from the district level, in 2009, our superintendent and school board allowed us the opportunity to assign a wellness coordinator at each of our 34 sites. We have schools and 3 ancillary sites. Each of them has a wellness coordinator who has really served as the champion for wellness at each of those locations. And their goal has been to provide wellness and educational programs, physical activity programs to the employees at that site to try to increase the engagement there at those levels. We did provide a stipend to those serving in that role. In 2009, we began doing biometric screenings at each of our 34 sites, and I have to thank Florida Blue for making that happen. And when we initially began, we had just a little over 54% of our employees that were participating in those. And most recently, the participation has increased to over 70%. We were able to identify in the last 4 years 86 employees who have had critical values identified during the screenings, and Blue Cross has an outreach program to contact those members and develop some action plan to help them address the critical value issues that they had. We also, in conjunction with the biometric screenings, offered on-site online health risk assessments. And we began in 2009 with about 26% of our employees that were participating in that, and have seen a significant increase. More than 60% of our employees now are taking the online health risk assessment. The top risk areas identified 4 years consecutively, nutrition and weight were 2 of the top contenders for risk issues. And so that has allowed us, having that information has allowed us to get our wellness coordinators to tailor their educational programs at the work site to address those specific risk areas. Another thing we began in 2009 was the Virgin Health Miles, which is a physical activity and biometrics monitoring program with an incentive program and a reward system. We provide pedometers to our employees so they can track their activity levels. We have a health zone at each of our work sites and locations so that they can monitor their biometrics. And the school district also provides health mile rewards for employees who are participating in our wellness initiatives. Employees have the potential to earn $300 a year for their participation in the wellness initiatives. And when we initially began the program in 2009, about 37% of our employees were participating, and we ended 2012 with 55% of our employees participating in that program. The wellness coordinators, they plan and facilitate various physical activity programs at their work site. It ranges anything from walking, Zumba, volleyball, P90X, whatever the employees at that site are interested in doing, the wellness coordinators try to design some programs that will meet their needs. In addition to the physical activity programs, the wellness coordinators also are facilitating educational workshops that address the key risk areas for our employee population. And we have several sites that have also started Weight Watcher programs, and those have been very successful at the work site. Florida Blue provides 16 online presentations for various health-related topics, and so our employees have the opportunity to view those presentations at their own their own time. And we also send out monthly wellness email blasts that covers various health topics with tips for improving health and wellness. In 2011, we began offering a medical insurance discount to our employees for participating in the biometric screening and completing the personal health assessment. We saw a 51% increase in participation in the biometric screenings, and we saw a 174% increase in the personal health assessments when we offered that discount. So money does talk. Employees do respond to that. And to address something mentioned in the last presentation, although I didn't put it in here, we also have a tobacco-free policy for all of our sites, all of our schools, and all of our school board properties do not permit any smoking or tobacco use on the properties. Some of our positive outcomes from our efforts, employee engagement has certainly increased. As we've already mentioned, we saw increases in participation in the various initiatives that we have proposed to our employees. Our personal health risk profiles improved. We saw the number of employees in the high-risk category. We saw those drop, and the number of employees in the low-risk category, which means that's defined as having 0 to 2 risk factors. The number of employees in the low-risk category improved, and that's important because our data shows us that on a per member per month per year medical claim cost basis, employees that are in the high-risk category are their costs are 122% higher than employees in the low-risk category, and that's information that was provided to us by Florida Blue. So getting those people moved from one category to the other is critically important. The level of physical activity improved, and particularly for those employees that are in the Virgin Health Mile program. When we first began the program, the employees that were participating, the employees in the active or very active group, there was about 37% in that group, and most recently we have 77% of our employees in the active, very active group. Our nutrition scores improved, our blood pressures improved, and this really was for Virgin Health Mile members, and I'm going to just give you some statistics because I thought this was very important. Employees in the ideal normal range were at 29% in 2009, and in 2012 we had 68% of the members in the ideal or normal range for blood pressure. So that was a significant improvement. Diabetes, cholesterol improved. And just one additional point, although we have not seen a decrease in total medical claims utilization for our total employee population since we began our wellness initiatives, the PHA data does show us that employees who are participating in the biometric screenings, completing the personal health assessment, have lower medical claim costs. The employees in the non-PHA participant group are 22% higher than those who are participating in the personal health assessment. Now to turn and focus on student wellness and what we have done in the arena of student wellness. We've had a collaborative partnership with the school district, Sodexo, who is our food service contractor, the Santa Rosa County Health Department, and the Santa Rosa County Extension Services Family Nutrition Program. And this group has really focused on student nutrition over the last 3 or 4 years. We have 14 schools that adopted the Healthier U.S. School Challenge, and this is a voluntary certification program that was established to recognize schools that participate in the National School Lunch Program and who have created healthier school environments through promotion of nutrition and physical activity. We have kindergarten through 5th grade students who are receiving nutrition education classes, and curriculums that they're using include My Plate, Ready, Set, Go, and Extreme Cuisine. They've covered topics on fruits and vegetables, milk, grains, and we provide a pre-test and a post-test so that we're able to measure the increase in their knowledge on nutrition. And we also send the information home to parents with the children so that we can help educate the parents as well. Our cafeteria program has adopted nutritional standards for meals and for snacks. The cafeteria menu changes have included offering whole grains every day, offering fresh fruits every day, only providing fat-free or low-fat milk in the lunchroom. Snack recommendations have been changed to meet the gold standard calorie and nutrient guidelines, and this information has been provided to parents and to teachers so that we encourage them to only use healthy snacks with their students. We have established beverage guidelines for our vending machines in the high schools, and those are actually turned off during the lunch period. And we do not offer any sodas that are not diet sodas in those vending machines, and we offer fruit juices and sports drinks. We have asked our teachers and our staff not to use food as a reward. It's real easy to buy everybody candy and pizza and that sort of thing, so we've asked them not to use food as a reward, and we've provided them with suggestions for alternatives. We have had classroom cooking demonstrations, and the high school students that are in the culinary programs have received cooking healthy lessons, and our elementary classes have received demonstrations on how to make yogurt parfaits and fruit smoothies. We have an interactive virtual cafeteria called NutriCafe. It's an online meal planning system, and it provides parents and students a fun, interactive way to learn about nutrition and to improve their health habits. We've offered events such as Cooking with Kids, which is a parent-child event that's held in the evening. The focus is on healthy eating for kids, and demonstrations are provided and samples of snacks are provided. These are very well attended. And our after-school child care program has also adopted the gold standard nutritional snack standards and are providing traditional nutritional snacks to the kids that are in those programs. And Deborah, you mentioned school gardens. I will have to say that we just put in our first school garden about 3 weeks ago at one of our elementary schools. Physical activity is our next area of focus with our students, and in the educational system there's certain requirements that are given to us by the state, and certainly those are part of our policy to follow the guidelines issued by the state regarding physical education and recess requirements. We have field days at the schools. This is a one-day event that the PE teachers at the schools coordinate, and students at all grade levels participate in various physical fitness activities as well as just fun activities that encourage friendly competition as the students compete against each other and students in their grade level. We have regular physical education, regular physical activity in our after-school child care program as well, and our policy does prohibit withholding physical activity as a form of punishment, making a child sit out of PE or that kind of thing for punishment. And then we also offer and encourage student participation in community events such as Jump Rope for Heart, Hoop Shoot, and that sort of thing. Positive outcomes with our students. We have seen an improvement in the BMI at all 3 grade levels that are screened, 1st, 3rd, and 6th grade. And we have seen an increase in the knowledge of nutrition with our students, and this has been validated by the pre and post tests.
Can you just give us a couple more highlights, because we got to make sure we have enough time to get to our other
I'm
panelists.
I'm sorry. I've just got so much to talk
I know, a
about.
lot of great stuff. Thank you. Yeah. So
And I'm going to take just 1 minute and mention that Santa Rosa School District was recognized in 2012 as one of 3 districts in the state of Florida that was designated with the Gold Distinctive Award as a healthy school district. So I'm real proud of that. Very quickly, there are two other programs. Two other programs that the Santa Rosa County Health Department partners with us on, the Students Working Against Tobacco and Teen Outreach Program, and they have worked with us in working with 9th grade students on risky behaviors and that kind of thing. And I thank you for your time.
Great, thank you, thank you. Yeah, we just want to make sure we have enough time for our other panelists and for Q&A, for you guys to ask them questions, because this is great work and it's very impressive, some of the data that you've had. Ted, I'm going to hop over to you.
Okay.
And have you take it from here and share some of the stuff you guys are doing at
I'd be
Landrum.
happy to. I want you guys to recognize my personal sacrifice here. I've become a consumer of healthcare, not one who just simply advocates for healthcare here.
It's the best way to learn about the system.
Well, we've talked about smoking and unprotected sex. I want to add yard work to the list of dangerous activities that you need to be concerned about as you work here. I'll talk briefly about what we do at Landrum, but I really want to talk about 2 other things, which is really another reason why, 2 reasons why this work that we're doing and launching today is really important, and that is workers' compensation and small businesses in our community. But Landrum, we have about 140 employees. Most of them are in Pensacola. So we've evolved our wellness programs from health fairs and flu shots and those kinds of things to contracting with a local organization for a comprehensive program that looks very much like Karen's, where it's individual health assessments, it's the availability of health coaches to work with individual employees, identifying what their risk factors are, having sort of themes of the month that run from nutrition to exercise, using the STARE campaigns, changing the way we do our employee luncheons to feature more healthy choices. So we've done all the things that Karen has talked about. We're just about 6 months into our latest initiative here, so we don't have the results yet to demonstrate what we do. But I have every confidence we'll have the kind of results that Karen's talking about because we're using an evidence-based approach. But here is the problem in our community. We do HR outsourcing for about 11,000 employees. They're in 32 states all over the country. But the problem is our average client has about 19 employees. So how are we going to get these? It's easy when you've got 140 employees, most of them in one spot. It's easy to have an organized program, relatively easy, to do the kinds of things that make sense and we know that work. The challenge that we have as a community is how are we going to get to that small auto repair shop out there, or even a small physician's practice that only has a few employees in that workplace. That's where I think the work that we're doing today is going to be important. We can certainly partner with that. We can work with our insurance carriers to get out there and do that work, but we've got to have a comprehensive community solution to get out there and get to those small employers out there who really are the bread and butter and the lifeblood of our economy here in Northwest Florida. So that's really another reason why what we're doing today is important, and that is reaching the small employer. The second piece of it is something we haven't touched on at all this morning, and that is workers' compensation. As an employer, you have to provide workers' compensation coverage. That coverage is based typically on a national rating bureau that evaluates the relative safety or risk factors with a particular position, so that obviously a secretary has much less risk than a roofer. And so you pay a premium based on that risk factor. But what we're seeing as we provide workers' comp coverage for about 9,000 employees. What we're seeing are the impacts of 3 particular things. One is an aging workforce, and that's particularly true in Escambia County, an aging workforce. Second is the impact of diabetes on injured workers. And third is the impact of obesity on injured workers. And if we don't do something to address those, we can't do much about the aging thing, I don't think. So we're really forced to deal with, can we deal with the issue of the incidence of diabetes in our community and the obesity factor? And let me give you let me tell you a story about an injured worker here in Pensacola. This woman was 66 years old. She had a workplace accident. She thought she had a sprained ankle. She went to the doctor. It turned out she had an ankle fracture. She was 5'9", weighed 325 pounds. This happened 5 years ago. We recently settled the case. We went from the surgeries, multiple surgeries, including, by the way, gastric bypass surgery that was paid for through the workers' compensation program to deal with this woman's obesity. The case is now closed. She's on a permanent and total disability. The total price tag for that ankle injury was $712,000. She was diabetic as well as being obese. The experience of that poor woman and what happened to her is one more reason why the work that we're doing here is so important, and we've got to go out and reach our community to address this problem.
That's great. Thank you. Thank you. It's great, John. That's it. I'm sorry. I'm going to go over to you, John. I was getting a little ahead of myself, but yeah, why don't you take it from there?
I was looking at it a little bit differently. I looked at a venture that the Escambia County has done, and what we have done since 2008. What I looked at is the cost. When we looked at it from 04 to 08, our utilizations, claims versus premium, that drives your health care, was 89%. So I kept going out to our people and said, we've got to start doing something. We've got to start doing something as employees, as management and stuff like that. So that was my vision is trying to get that going. 2006, we started health screenings. Health screenings, as indicated by both individuals here prior to me, are very important in the whole process. We struggle with that because we've got a wide range, blue collar, white collar and stuff like that, and we're so diversified, we've got a range from all the way up north to south, so we have a real tough one. We're only running about 25% of our employees going through the health screening. And out of that 25, 80% of those have high risk, one or more. So that's one of the things that we struggle with. But what I found here is a lot of that support to get folks there is management support. That's people out here, us making that support and make sure it happens. Our next venture that we did in 2008, we found that we have a very high amount of retirees on our plan, the ones over 65. We gave them a discount on their premiums to help them out. Well, when I mean discount, they were getting lower than the active employees and the other retirees there. So we raised that premium out there, and we start educating our employees. We started educating them about the other products out there. We provide a group Medicaid, Medicare plan for them in the plan. We reduced the, in 08, the utilization for claims versus premium was 145%, and these were Medicare eligible people. We reduced that to 72 since 08, and we have 233 lives who were covered prior to that time frame. Now we have 64 lives, so we've reduced that claim, so it helped us in the overall. I have not heard one retiree in those years that have complained about when they moved to another plan. So that was a very win-win situation, both for the county and the individual. In 2009, as we talked before, we started there we go. We started a tobacco discount program. No hiring policy. I missed the one before that. I'm sorry, go back. Can I go back? There, nope, too far. I'll get it right. We developed a tobacco-free hiring policy and tobacco-free workplace policies. We had some challenges with a tobacco-free hiring policy at first. Believe it or not, our managers were trying to figure out ways to get people hired because they were still smoking, and that was a struggle we had at first. We've been in the process for a number of years now. We don't have the issues that we had in the past, so it is working for us right now. In that same year, in 2008, we got $250,000 towards a grant from our healthcare provider to help initiate our wellness programs. So that was another key factor in our whole process. In 2009, we started a tobacco discount program for employees. Each employee that signs a form saying they are tobacco-free get a $20 discount per month. But they also have to agree to go through a random testing. And we got the levels high enough that they really have to be using tobacco. They can't, it's not that we're gonna be that threshold that you're borderline. And it actually works. Last month, we caught a couple people that were smoking because of the random testing, so it does work. One of the things that we did in 2005 or 2008 with the initiative, with the money that we received for the Starting Wellness, we developed 3 wellness centers and gyms for our employees. That was a critical, they wonder why you do that. Well, it makes it easier for our employees during workout time, during lunchtime to use the facilities. We've got one downtown, we've got a convenient location where people can get to them, so that really works. We signed what we call a 3-year pro-share contract with health care providers. What's that? Is basically you have administrative costs. If you're below that administrative cost, you receive some money back on that one, and that will be substantial. With probably my last slide, you'll see where we went in that particular area. We spent about $19,000, or almost actually more like about $50,000 with fitness equipment for our employees. In that particular area, that was a very positive. In that same year, we entered a partnership with the Sheriff's Department to open a employee health clinic. The greatest thing that we ever did. In January, we opened that clinic to serve all eligible employees, retirees with county-sponsored health insurance, and their dependents 2 years or over. This has been a great adventure for us. I think, let me see, I'm just going a mile a minute here, I apologize. I'm trying to get everything ready here so I can do what I'm supposed to be doing here. We added fitness equipment in 2012, and we see about 9,000 visitors in the wellness center a year. So that's a pretty good, substantial amount of people seeing the fitness center. And what we do is, I'm not sure if that's correct, that's fairly close. I got to count on people doing it, signing in. Sometimes they have a challenge doing that. Clinic, the thing that I think is great, we're open 48 hours a week for our clinic. We have a doc, an MA, a PA, 3 medical assistants, and a nurse manager. We handle both primary urgent care in this clinic. 65% of our patients are urgent care. Our clinic average time, when's the last time you were able to go to the doctor's office, get in and out in 30 minutes? This is 2.5 years we've been doing this. So that's productivity we talked earlier. ROI is 2011 to 12 was over 200, return on investment about $200,000 ROI in that particular area.
Right.
We have been under budget all through 2.5 years that we've been in the process. So it's been really positive things. Some of the things that we've done in the clinic, we've reviewed job descriptions and determined what was needed for physicals, for employment, brought them in-house. Since starting when we've saved about $50,000 in that particular time frame. We conduct all firefighters, both voluntary and regular firefighters, their physicals in-house. We've also, periodically we go through to see what we can add in the clinic to help reduce our cost. And what we've done there, we brought the retrofitting into there. That's the other thing, it's not getting 2 different directions. One is they used to do the physical, and then they have to do the retrofit. Now we do it all at one time, so it saves time and cost, and we don't lose track of people.
So I'm going to ask you to wrap up a little bit first.
Okay, I'm
so we
sorry.
can get to,
We're going here.
get to
Okay,
Deb.
we're going. We started a weight management program, and you can see the theory. Pretty much, I'll let you read there. We've 10%. We've improved blood pressure, have saved money and discount for several medicines, reducing medicines. We've found cancer, lesions. A lot of times with the primary cares in the old days, you do a lot of stuff inside the clinic. Now you get a lesion, you go to the specialist, you got a copay to go to primary care and specialist. We do it in one-stop service. So it's kind of a nice service. We've saved thousands of dollars by using that thing. Finally, final results, claims versus premium. You remember my first status there, we're looking at 89%. Since October 8th to present, we're at 70% utilization. October 10 to present 75, and this year 69%. What the final result was that this year, just this last April, we received $2.6 million from the healthcare provider for the plans that we've done here. So we've done a lot of good things. We've been 3 out of 4 years, our health insurance increases have been below the national average. And what I really want to come down here, top management must be involved. It's the key to make sure things happen. And employees do see what management is doing.
Good.
A lot of times we think sometimes they don't see it, but they do it. And it's extremely hard to engage people to better understand healthcare until something happens to them. I mean, a lot of health professionals here, a lot of professionals, I'm front line, I deal with claims, I deal with people. They don't care. There's 3 times a year that they care. Management cares during the budget cycle of how much the healthcare costs. You care when the premiums go up and change plans with employees. And the last time is when they have a major health issue. It really affects them, it really does. And that goes from management, from first line blue collar person to top management. I deal with them all, and they all affect when they walk into us and start seeing what happened. But we've had a pretty successful story, and we can't become complacent on what we do, because as soon as we do, we'll go right back where we're at.
All right, I'm gonna take a pause there. Thank you. Thank you, John. Hear the great work that folks are doing, and Deb, I'll pass it to you to
Great,
bring it
thank
on
you.
home.
Good morning. Today I'd like to talk with you about the evolution of the wellness program at Gulf Power Company. Now, although our program is quite vast, I'm going to limit our discussion today on just the 4 areas which are the primary focus areas for the partnership. So think about this, and this is just going to help set the stage. How are you going to be successful in this increasingly competitive world without a healthy and high-performing workforce? Have you ever thought about how the health of your employees can impact your competitive advantage? Or how a healthy workforce can help your company meet its business objectives? Or that your own work environment could actually pose barriers to healthy living? So let's think about what the current healthcare strategy is, right? We wait for disease to happen, and then we treat. So it's reactive. So if we think about that in terms of quality, if we use the same strategy, it would translate into waiting for defects and then waiting to fix those defects. So if we continue to wait for defects and then try to fix those, will we ever solve the fundamental problems? This is why it's important for us to focus on prevention. For those in customer service, is it better to keep a good customer, let that one go and just cold call and get a new one? Our champions are our healthy employees. We want to keep those people healthy. If we put a changed person back into the same environment, will that change be sustained? Critically important to create a supportive environment that supports those healthy lifestyles. Wellness is an investment in your #1 asset, your employees. Oftentimes when we hear about budget cuts, wellness programs are the first ones to be cut because it's seen as just an expense. We really like to change that paradigm and look at wellness as an investment. Gulf Power's wellness program started in 1997. And how our program started was really as an activity-based program where there were a lot of one-time events. So we had health fairs, we had lunch and learn seminars, we had health screenings. A lot of those activities weren't really connected. So in 2001, we transitioned our program into a results-oriented, integrative, and comprehensive program. Boy, that's a mouthful. We basically created the program based on a model that looks like that pyramid on the screen, where the base of that pyramid is awareness, really helping employees understand their overall health, what their particular health risks are, and what resources are available and how to access them. The second stage is how do we encourage and provide opportunities for our employees to have healthy behavior change, or those that are already healthy, how do we help them maintain that? So we provide a variety of wellness programs and services all along the health continuum, from prevention all the way through chronic disease management. And the very tip of the pyramid is creating that supportive environment. How do we create and foster a work environment that supports those healthy lifestyles for sustainability? So a starting point, as was mentioned earlier today, is we have an annual health assessment program that includes health screenings and a health risk appraisal. In 2003, when our program started, we had about 53% of our employees participating in that, and cumulatively in 2012, we were up to 84%. The chart listed here indicates what the health status of our population really rolled out to be as a result of that program. So as you can see, the majority of the population falls in the low-risk category. That is 0 to 2 health risk factors. Our average risk was about 2, and then the average wellness score is about a B+. When we specifically break that down, oh, let me back up, I'm sorry. One of the things I wanted to mention from a cost perspective on this slide here, when we look at the different risk categories, what we know in looking at our data is that the natural flow of risk is to high risk. The do-nothing strategy ultimately leads to high risk costs and risk factors down the line. Without early identification, the high cost spike is not modifiable. So if those employees fall over the fence, you can never bring them back to where they were before they got to a chronic disease state. We also know that as health risks and age increase, so do those health costs. So that's just something to kind of keep in mind here. Specifically, when we look at the health risk prevalence of our population, it's looking pretty bleak. In terms of weight, which is one of our categories that are focus areas that we're going to work on. But this kind of shows you, based on our health risk appraisal and health screening program, what our population looks like. And why this is so important to do a health risk appraisal is it provides you with a roadmap to determine what are your areas of priority for your specific group. Becomes also an opportunity for population health management. So from the previous year, what we saw in a decline in the following health risks. Our sedentary population decreased, those with an existing medical condition, cholesterol, and smoking. In 2012, we actually took a different approach to our program. What we realized is that just providing employees information and education does not create health change, does not create a healthier workforce. So what we decided to do is actually provide employees with several different tools as well as opportunities to teach them how to be successful in healthy living lifestyles. So teach them new skills that they can apply and be successful. We just kicked off our 2013 annual health assessment program, so it'll be interesting to see the impact of that new approach on our health risk appraisal results next year. In terms of some of the programs that we've implemented over the last few years, or actually several years, this kind of shows you a model of progression. In 1985, we implemented a no-hire tobacco policy. So new employees would sign a form indicating that they have been tobacco-free for the last 6 months. Current employees at that time were provided tobacco cessation programs. Those that did not quit during that time were grandfathered into our program. So that is why you saw a certain number of percentage of employees that were still smoking. In 2005, we designated smoking areas on all of our campuses, so you don't necessarily have to walk through a cloud of smoke to get into the building. In 2006, we implemented nicotine testing, which is part of our post-offer drug screen urinalysis. 2009, we implemented tobacco cessation resources, free nicotine replacement for 8 weeks, and a Quit Power telephonic health coaching program. And really interestingly, in 2011, we started a partnership with local AHEC organizations to provide oral cancer screenings. We have a high number of field personnel who use chewing tobacco or dip, and what we wanted to do is provide them an opportunity to get a screening where they might not otherwise do that. And this year, this was actually just 2 weeks ago in our screening, we found 6 cases of potential issue, so they were referred on. What I want to also mention to you is any of the items that have an asterisk beside them, those are no-cost programs. So if you do not currently have a wellness program in place, and you're hearing all of us on a panel talk about all of these programs that we have in place, don't feel overwhelmed and that you have to put this really comprehensive program in place and you don't have a budget. There are many things that you can do that are very low cost or no cost at all, and I just identified some of the things that we have with an asterisk. In terms of weight, and this really should have been titled nutrition, so please excuse me, we started off providing, like several of the other panelists, nutrition programs, department-type challenges. We do bring in Weight Watchers instructors to provide Weight Watchers at work classes. This is an out-of-pocket cost for the employees. They do pay for that cost up front. if they meet certain participation requirements, the company will offset and subsidize a portion of that fee. In 2009, we implemented Meeting Well guidelines, and this is actually a guideline that is company-wide. For every catered meeting, event, or celebration, healthy food choice is going to be available. And this all kind of plays into that respect of how do you create an environment that supports healthy lifestyles. If you have a celebration or a lunch meeting and all you're providing is fried chicken and macaroni and cheese, you're not really supporting those employees that are trying to eat well. You actually create a barrier. In 2010, we implemented Make the Right Choice, which is a healthy snack or a healthy vending machine initiative. We created healthy snack guidelines and worked with our local vendor to be able to identify the snacks in their service offering and put those snacks in the right-hand side of the machine. So it was very easy for employees to not have to remember how many calories and what's the fat gram and the sugar grams. I'm not sure what that is. All they need to do is pick something on the right-hand column of the machine if they wanted to make the right choice. 2009, we implemented an online and telephonic weight coaching program with a dietitian. In 2012 and 13, we provided a nutrition program called Eat Right for Life. This is not only an educational program, but it teaches it builds nutrition skills. So every week we would provide employees with education as well as an opportunity to learn a new skill on how to properly manage their nutritional intake. Another, I think, rather innovative program that we did and a tool that we provided is we did an activity called Apple versus Pear. And we provided our employees with a tape measure, and we instructed them on how to take a proper waist circumference. And a proper waist circumference is not necessarily what the size of your jeans are, right? It's really the circumference of your entire waist. So anyway, we went ahead and taught individuals how to take a proper waist circumference, and we used that as an opportunity also to educate them on risk factors for metabolic syndrome. In terms of exercise, we partner with local fitness centers, and we provide discounted rates, corporate rates, with local fitness facilities out into the communities. In 2005 and 2008, we created a custom pre-work stretching program for our field personnel. So the nature of their work is very physically demanding. We wanted to make sure that we did not set them out into the job deconditioned. So we wanted to be able to provide them with opportunities to stretch and to get their body warmed up before they partook into their physically demanding jobs. We have on-site fitness centers. We also have a fitness reimbursement program, again, based on participation requirements. If employees participate a certain number of times each month, they would be eligible for that subsidy. A very free and low-cost program, utilize stairwells. There is a Stairway to Health program that's available online. You can Google that and you can download that program. They have great posters and communications available as well. We do promote participation in community fitness events, a great way to rally employees together, build camaraderie, participate in Heart Walk, Making Strides Against Breast Cancer, and others. We also brought in a trainer to teach employees how to run their very first 5K. So we implemented last year the very first Couch to 5K program, and it was such a tremendous we got such a tremendous response from this that we've had over 70 of our employees in the Pensacola area go through this program, truly Couch to 5K, and they finished their own 5K, so it was a really big accomplishment for them. In terms of participation, just wanted to share with you, cumulatively over the last several years, we started at about 42% of our employee population participating in wellness. We are up to 95% and probably a little bit higher maybe, or hopefully we're at that same rate because this chart only goes till 2010. I listed engagement on there because what is critically important is that you have employees engaged in a program throughout the year, not just engaged in sporadic programs. They do one program and then at 6 months later they do another program, but really trying to provide a variety of opportunities where they are in their stage of readiness and change to be able to integrate into a healthier lifestyle. What I wanted to mention from a cost savings perspective, from 2007 to 2011, our total healthcare costs, this would be including medical, pharmacy, and sick leave, remained flat. So we were really happy with that. And also, based on a national study by ION, the annual healthcare costs per employee from 2005 to 2012 increased at a rate of about an average of 6.6%, and we were able to enjoy an annual increase rate of 1.6%. So what I want to leave you with, though, is that it's really important to look at the whole picture. And I think we talked a little bit this morning about it's not just about the discount or the cost savings on your medical costs, although that's incredibly important. You see the savings in other things in terms of improvements in productivity, improvements in morale. You can certainly use wellness programs as a recruitment tool when you're trying to get new talent into your organization. It also improves morale and the overall health and well-being of employees. Key points: wellness is an investment. It's really important to provide opportunities along that continuum of health, from prevention to chronic disease management. Keep those healthy employees healthy. They are your champions. It's much, much better from a cost savings perspective to prevent something than to wait until they're chronically diseased and try to fix them. Create that environment supportive of healthy lifestyles, and an engaged, proactive, and supportive leadership is essential for success and sustainability. I also want to just leave one last thing. Building a culture of health is more than just putting a bunch of programs together and having a bunch of different activities for employees to do. It's really orchestrating a symphony of the appropriate programs and resources, creating a supportive environment, and building relationships. All of this driven by leadership in word and in action. Thank you.